Well, many researchers try and save individual patients. You know, they worry about cancer. We like to think health service researchers have as their patient the whole health system. So we're trying to make healthcare more effective, safer, and survive, be a sustainable enterprise. So health service researchers generate the evidence to make that possible.
Yes, well, as a clinician, I see it as the science that allows us to understand healthcare that we're delivering to consumers and communities, but also understand the healthcare from the clinician's point of view, those people delivering care, and marrying the two worlds so we can understand with data how we can improve the delivery and the receipt of good quality healthcare.
I think health services research is it's about asking the right questions on behalf of consumers and on behalf of society about the way in which our health system and services are actually working, and understanding whether or not they're working in the way they're intended to do. And I think one of the great things about health services research as well is it's about creating evidence. And what I mean there is a whole range of evidence that can be economic and financial sort of evidence, but it can also be qualitative evidence of people's views of what's happening. It can be consumers' personal views and experiences of the services. And the great skill of health services research is to blend all of that together to answer those critically important questions.
Well, it's a very broad term, and I suppose it depends on your priorities, but for me, what I'd like to see from health service research is really to see good ideas being put into clinical practice. I mean, there's clearly a need to bring the outcomes of basic science and clinical research to bear in terms of clinical practice, and that translation is where I see health service research as very important in terms of helping to deliver that, but also showing us how it can be done, identifying the problems that can prevent it from being done, and also to show us the benefits of implementation in terms of outcomes and economic benefits and so on. So for me, it's all about bringing ideas into practice and evaluating that process.
Health services research means a number of things, and that's because of the complexity of health systems. So health services research might mean using different methods. It might mean focusing on different parts of a healthcare system, or it might mean working with different types of people in the research endeavour. So it's very, very eclectic. It's very, very broad in terms of the scope of coverage of health services research, but ultimately I think the focus of health services research is really on understanding how health systems and services function and are delivered and organised, and then how they might be improved and how they might be evaluated.
I think for me, health services research field is a very interesting phenomenon. I would say that I'm really fascinated by the emphasis of health services research on the practical benefit for the patient. On the other hand, I do believe that it's an amazing field because it's really multidisciplinary, where you can have different specialities like health economists, qualitative researchers and other tribes of researchers all coming together and actually making sure that their research has impact.
So I kind of think of health services research as being two broad categories. There's kind of the clinical side of it is more focused on quality improvements, improving models of care or bringing in new models of care into clinical practice. And then the other component is the more policy level, answering questions about what's working within the healthcare system at a more general level in terms of whether it's funding or incentives or how patients and clinicians are interacting. Is that kind of policy level.
My experience as a clinician turned policy person means that I've had quite a lot of frontline experience, but more importantly on the government side, I've actually seen how policies are made. How I see health services research is in fact the analysis that underpin some of the key government decisions in terms of the design of a system, why a dollar should be spent here rather than there. I think they are, resource allocation, health economics question, but in the end, I think they all are underpinned by good health service research. Without that, the government can't actually make the decisions. My experience, for example, when I was working at a Commonwealth government, is that you have independent bodies that are actually set up to look at medical services effectiveness, like the Medical Service Advisory Committee, the Pharmaceutical Benefit Advisory Committee, and the Prosthesis Listing Advisory Committee. These committees are independently chaired by experts, but the only reason why they can actually carry their job to inform the government of where the investment should go is because there are good health service researchers underneath and across Australia to actually do the work on a day-to-day basis.
Okay, that's a really hard question to answer very quickly. I'd say for me it actually starts probably down at the clinical epidemiology level, so how individuals as groups are then treated in hospital, right up to the population perspective looking at health, and then within that I guess there is any number of domains from health economics to sociology and anthropology, all factored into the same discipline of health services research. So it's a broad church. I would say overall interested in questions around safety effectiveness, cost effectiveness, equitable access to affordable healthcare and preventive programs, and even community programs would fall into that, I think, as well. Yeah.
Well, health services research is really the future of our health service. It helps us find the answers to the problems that we face in providing health services to our community, and it helps us find a pathway to implement new models of care and improvements, innovations in healthcare.
So I think health services research is the science of trying to understand and improve our healthcare system for patients, for the health professionals that work in it, and for the public that funds the healthcare system.
Health services research means, to me, it's about the functionality of the health system. So it's both clinical and non-clinical, but more importantly, it involves researchers getting together with health system managers and providers of care, multidisciplinary providers of care, to identify and solve problems together. And then once that a problem or resolution is determined, to look at ways of implementing it, scaling it, and having a genuine impact on how services are delivered to patients.